psychiatry, pathology, anxiety disorders. All right, so anxiety disorders is going to encompass a lot of different types of pathologies that we're going to discuss. The first being panic disorders. So the first thing I want you to take away from panic disorders is in the question stem, you're going to see worry about future events. The patient is going to be worried about future events. That's very key to it being a panic disorder. If you see that they tell you that the patient is afraid of doing something because they're worried about future panic episodes or future events where they will have a panic attack, that means that they have panic disorder. They're trying to hint you at panic disorder. So if they have worry about future episodes or events of panic disorders, and when I say events, I'm not talking about they're worried about going to a concert. No, they're worried about having another episode, another panic attack. That's what I mean by event. So they're worried about having a future episode. Now, these are the 4 key takeaway points. 1, recurrent unexpected panic attacks. 2, abrupt surge of fear. 3, persistent worry about future attacks, which is the key thing that I just discussed. And 4, they restrict their activities because of that worry. All right? Those are the 4 key takeaways for panic disorder. All right? Very, very important, very easy. Okay? Now, it's associated with prominent somatic symptoms. So, essentially the patient's going to experience multiple somatic symptoms, and that could be palpitations and paresthesias, abdominal pain, and things like that. That's what I'm talking about when I say somatic symptoms. So actual real world symptoms that they feel. So it's highly associated with prominent somatic symptoms. But besides those 4 things I said about the recurrent unexpected panic attacks, abrupt surge of fear, persistent worry about future attacks, and restricted daily activities because of that worry. The only last thing is an association with prominent somatic symptoms like palpitations, abdominal pain, things like that. All right? So that should be your first thing for panic disorders. It's very easy to identify with pretty much those 5 things. Now, treatment. CBT, SSRIs. Perfect, very easy. All right, so let's move on. Next is phobias. So another part of our anxiety disorders are going to be our phobias. So phobias are severe, persistent fears or anxieties about a specific thing. Okay, and that's going to be greater than or equal to 2 or to 6 months, lasting greater than or equal to 6 months. All right. So the key ones are social anxiety disorder. So social anxiety disorder it involves excessive fear of embarrassment in social situations. Okay. So social anxiety disorder, the patient's going to feel very scared in public speaking situations or using public restrooms. They're afraid of being embarrassed in a social setting. Okay, and this is very key because there's another thing that's very similar, which is known as agoraphobia, that they like to trick you on. Now, agoraphobia, this is going to be very, very helpful for you to differentiate. Okay, what you need to know about agoraphobia, it's a fear of needing to flee, to leave a place with no help available. Okay, so it's like a fear of oh my gosh, I'm in this area and I need to get out of this social situation and I have no ability to leave. Okay, so it's an irrational fear or avoidance while facing or anticipating specific situations like public transportation, closed spaces, crowds, being outside of home alone. Right, so you have a fear of needing to flee with no help available. Okay. So concern that help or escape may be unavailable is very key to agoraphobia. Whereas social anxiety disorder, they're not too worried about leaving or help being there. They're just worried about being embarrassed in a social situation. All right. Now, agoraphobia is a common comorbidity with panic disorder. Okay. So if you see agoraphobia, it can also present with panic disorder. So don't get confused. Okay. It's just they can sometimes go hand in hand with one another. And next is going to be specific phobias. Okay, so specific phobias are going to be your arachnoid phobia, right? So if you have arachnophobia, your fear of spiders, okay, that's one example, or your fear of heights, right? So those are your common ones. They call them specific phobias. So if you see a specific phobia, the key thing that they like to treat the patient with is CBT therapy and exposure-based therapy. So exposure-based cognitive behavioral therapy is going to be your best friend. So exposure-based CBT is how they'll say it. That will be helpful for specific phobias because you could go to a therapist and then they will put spiders on you, or they'll start with oh, you see that spider? It's in the room with us. It's not going to hurt you. And then the next time it's going to be out of the box. And then the next time it's going to be crawling on you. And then the next time, you know what I mean? I don't even know what would be worse or just more close to being a spider than just it crawling on you. But that's what exposure-based CBT is. That's specific phobias. All right. Next is generalized anxiety disorder. So Generalized anxiety disorder, the way I look at it, is excessive, uncontrolled worry about multiple issues that last for greater than or equal to 6 months. Okay, so they have excessive worry that's uncontrollable about so many issues. It's not only about one single issue. They're worried about like their kids. They're worried about their work. They're worried about their relationships. They're worried about their friendships. They're worried about like every single thing. There's so many things they're worried about, but it lasts for greater than 6 months for it to be generalized anxiety disorder. Okay, so different aspects of their daily life is going to be associated. All right, so now you can have difficulties concentrating. They'll have restlessness, irritability. They'll control their muscle tension. So they'll have like some type of they'll hold it in their jaw or they'll hold it in their back, and that increases their muscle tension there. They'll have low energy, like fatigued, and they can have sleep disturbances. Okay, very important to know generalized anxiety disorder. Okay, but remember, keep in mind, it's for longer or equal to or longer than 6 months with these symptoms. Okay, now treatment is CBT or SSRIs or SNRIs, right? Remember, that's always going to be our first line. But you could give them buspirone as one type of second line treatment, right? Next is going to be obsessive compulsive disorders. So obsessive compulsive disorder it's in the name. You have obsessions, and then they're followed by compulsions. So obsessions are just like recurrent intrusive thoughts. So for example, if you have someone with OCD, they're going to have recurrent intrusive thoughts on, did I turn off the oven? 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 So they're going to have that recurrent intrusive thought. Is the oven still on in my house? Is it going to burn down my house? And so it starts to spiral. So it leads to a compulsion. So that obsession leads to a compulsion, which is a repetitive, like time-consuming action. So let's say they're out of the house shopping and they think about this intrusive thought. They have to go home, check the oven, it's off. Then they'll leave. Then they go to like a restaurant. They're like, wait, oh my gosh, did I actually check if it was off? Or am I just like lying to myself? So then they go back home. So it's time consuming and it's a repetitive action is the compulsion. Okay. Very, very high yield to know. OCD is going to be like ego dystonic. So they like to compare it to obsessive compulsive personality disorder. And we'll talk about the personality disorders, but obsessive compulsive disorder as a anxiety disorder is ego dystonic, meaning that the behaviors conflict with your goals. So you going home every single 5 minutes to turn off the oven when it's already off, it's going to be getting in the way of your goals. It's going to be getting in the way of your life. So these behaviors conflict with goals. Whereas for your personality disorder, if you have obsessive compulsive personality disorder, it's going to be egocentric is what they call it, not ego dystonic. Egocentric, meaning that it helps with things. And we're going to talk about personality disorders later, but it's going to help with your goals. There's no conflict with your goals and your behaviors. It actually coincide with one another. So it's like if you're OCD or if you're obsessive compulsive personality disorder, if it's a personality thing, then it's going to be like you studying hard because you're worried about the exam or something like that. So that's your obsession and your compulsion, and that will help you on your exam and achieve your goals. Okay, but obsessive compulsive disorders, it's going to be separate. It's going to be ego dystonic. Okay, it's not a personality disorder. It's an anxiety disorder. All right. So there's a couple things that are associated here. You have body dysmorphic disorder. This is just a preoccupation with just your body and its appearance. And you're going to see in question stems patients looking in the mirror continuously, looking at their thighs, looking at, at their stomach, at their belly. And it's going to cause them severe emotional distress. So like mirror checking continuously and excessive grooming continuously. And it's going to be seen commonly in eating disorders, which we'll discuss later on. And then the next one is trichotillomania. Trichotillomania is just going to be the compulsively pulling out of one's hair. They love to show a photo of it, and they love to compare it to tinea capitis. So what I recommend you do is look up a photo of trichotillomania, all right, and compare it to tinea capitis. Look at the difference in imaging because they love to show you it. And I will tell you right now that it's going to cause significant distress and persist despite attempts to stop. So the patient is probably in the question stem going to be some type of anxious. They're going to have some type of psychiatric illness that they're going to talk about, or they're going to talk about some type of anxiety that they've been experiencing previously, okay? And another thing that you can notice, which is very important, is that you will have like baldness on any area of the body, most commonly the scalp, like the head. They're going to show you the scalp, but the remaining hair shafts are different lengths, okay? So that's how you could help differentiate it from other pathologies like alopecia, okay? So if it's just essentially someone pulling their hair out, they're not going to pull all the hairs out at the same exact length. They're not going to all rip at the same length. They're going to have different lengths in the remaining hair shafts, okay? So you're going to need to treat them with psychotherapy. All right. So keep in mind all these anxiety disorders, they're relatively straightforward, not too bad.